Movement, rhythm, and conversations with Tafari. Unchain your mind, let your spirit be free.
Welcome to Movement, Rhythm, and Conversation, the show where we delve into the profound impact of religion, spark provoking conversation, explore the world through an open-minded perspective. I'm your host, Tafari, here to bring you engaging discussions, eye-opening stories, and conversation that pulls no punches. Whether it's faith, culture, creativity, or real-life experience, we keep it raw, honest, and unfiltered.
Build black banks on black land, pass down wealth like a real inheritance plan. No more praying for what we can create. No more waiting on systems designed to dominate. Teach our daughters how to own their worth. Teach our sons they are gods on this earth.
Peace and power, family. Before we get started, please take a moment to do something important. Hit the like button, subscribe, turn on your notifications so you never miss an episode of Movement, Rhythm, and Conversations with Tafari. Every click, share, and subscriptions help push this movement forward, spreading knowledge, rhythm, and power into our community. Let's rise together. Now, let's get into today's conversation. Welcome to Movement, Rhythm, and Conversations. I'm your host, Tafari. Today's conversation begins with a simple but powerful truth. What we eat carries history. The food that sits on our plates today are not just about taste or tradition. They are about survival, trauma, and inheritance. Many of the dishes we call comfort food were born in a time when Black people were fed scraps, forced to stretch the least nourishing ingredients into something that could sustain life under brutality. What once kept us alive now quietly contributes to illness, obesity, chronic diseases. In this episode, we are going to examine how the legacy of slavery-era diet still shapes the health of our community and why healing must begin not just in the mind, but in the kitchen. Let's get into it. Some years ago, while working on a project in San Diego, California, my life changed overnight. I woke up one morning to discover the entire left side of my body was numb. Within hours, I found myself in a hospital bed, listening as a physician explained that I had experienced a stroke-like event. Shortly after, I was diagnosed with diabetes. I was placed on insulin, metformin, and told without hesitation that this would be my life moving forward. For someone who has always lived with energy, movement, and purpose, that moment was devastating. The diagnosis didn't just affect my body, it shook me mentally and emotionally. I couldn't imagine a future defined by dependency on pharmaceuticals or a life dictated by medical limitations. The months that followed were grueling. Physical therapy became my routine as I worked to regain strength on the left side of my body. While my physical condition slowly improved, the emotional weight of believing I would be medicated for life lingered heavily. Depression quietly creeped in, not from weakness, but from the fear of losing autonomy over my own health. That season forced me to confront a powerful question. Was this truly the end of my vitality, or was it the beginning of my awakening? I chose the latter. Through discipline, education, and an internal lifestyle shift, I committed myself to reclaiming my health. I transformed the way I ate, drastically reduced sugar intake, embraced consistent physical activity, incorporated natural supplements, and adopted the philosophy of eating to live rather than live to eat. The results were undeniable. I lost 75 pounds and, more importantly, reclaimed control over my body. Today, I live a healthy, strong, and insulin and metformin-free life. Healthy living is no longer a phase or a program. It is my lifestyle. I'm still able to enjoy the foods I love, but now with awareness, balance, and intention. I no longer live in fear of my health. I live in ownership of it. This is not a medical claim. This is my personal testimony. My story stands as proof that transformation is possible when you challenge limitations, take responsibility for your well-being, and commit to long-term change. If you are serious about getting your health together in 2026, let my journey serve as confirmation that reclaiming your life is within reach. Historical roots of diet pattern. The food that sustained enslaved Africans in the United States were often the scraps and leftover of plantation diets, salted pork parts, inexpensive cornmeal, minimal vegetables. These were what kept people alive under brutal conditions, not what would be considered nutritionally balanced or healthy, promoting today. Over time, these survival foods evolved into what we now call soul food, which remains foundational to many families and communities' gatherings, from survival to traditions. While these foodways originated from necessity, they became cultural staples. Fried foods, salted meat, and calorie-dense preparation techniques communicated comfort, identity, and resilience. However, the nutritional compromise inherent in those historical food choices have persisted into modern diets, often without full recognition of their long-term health impact. Diet quality disparity today. Evidence shows that African American population has, on average, poor diet quality compared to other racial groups, including lower intake of fruit, vegetables, whole grain. Factors linked with increased risk of chronic disease. This is not a matter of personal failing. It reflects systemic patterns of food access, affordability, and economic equality. Obesity, chronic disease burden. Obesity rates are significantly higher among Black adults, with data showing that roughly 42.6% of African American adults have obesity BMI in the 30s, compared with lower rates in the general population. Obesity is a risk factor for type 2 diabetes, hypertension, cardiovascular diseases, all of which disproportionately affects Black communities. Food access and food insecurities. Black communities are more likely to experience food insecurities and inability to reliable access to healthy foods than other groups. In 2023, about 22% of Black people in the United States face food insecurities, compared with lower percentages nationally. Food deserts, economics, inequality, and housing segregation all contribute to limited access to fresh produce and health-promoting foods. Dietary habits linked to health outcomes. Traditional soul food cooking often rely on high sodium, added fats, and fried preparations, which are associated with increased risk of hypertension and heart disease. African American diets in some studies have shown high total and saturated fat consumption and excessive sodium intake patterns linked with cardiovascular mortality. Cultural dimensions over food and health. Soul food remains treasured for its cultural significance and familiar bond. Changing dietary patterns is not just a matter of nutrition. It touches identity, history, communities, cohesion, and resistance to external judgment. Nutritional change must therefore be culturally sensitive and community-driven, not imposed in ways that dismiss heritage. Root causes beyond culture. Diet-related disparities are not solely cultural. They are shaped by structural determinants: racism, inequality in food environments, healthcare access, economic opportunities, and discriminatory zoning. These forces influence what foods are most accessible, affordable, and normalized in communities. Emerging health interventions. Research have shown that dietary change, such as plant-based soul food adaptation or cultural tailored nutritional programs, can improve risk factors for heart disease and weight. Interventions such as the New Soul study indicates that innovative community-forced dietary programs can positively affect health outcomes. Towards nourishment and liberation, understanding the historical lineage of diet, the systemic obstacle to healthy eating, and the high burden of chronic disease highlights the need for holistic approach to Black health. Structural change in food system, economic empowerment, access to fresh foods, and community education are essential. Health liberation requires acknowledgement how history has shaped present patterns and reclaiming food ways that nourish the body and community.
Movement, rhythm, and conversations with the far. Unchain your mind, let your spirit.
As we close, remember this: tradition should not cost us our lives. Honoring our ancestors does not mean repeating the conditions that they were forced to endure. They ate to survive. We must eat to thrive. Understanding the roots of our food choices give us the power to change them. When we reclaim our health, we reclaim our future, our families, and our strength as people. Liberation does not only happen in politics or philosophy, but it also happens in what we put into our bodies every single day. The change may be gone, but some of them are still on our plates. And once we see them, we can finally choose to set ourselves free. This is Movement, Rhythm, and Conversations. I'm your host, Tafari. For those of you that's interested in a total wellness plan, hit me up. I can help you get your life back. Stay Black and peace. If today's conversation spoke to you, don't keep it to yourself. Share with the family. Hit the like button, subscribe, and turn on your notification so you never miss an episode of Movement, Rhythm, and Conversation with Tafari. Together we rise. Unchain your mind, reclaim your soul.